Hello everyone, it's Dr. Borus from Dickinson County Board of Health and Lakes Regional Family Medicine here in Spirit Lake, Iowa. It is the 7th of January of 2021. Finally, 2020 is over, and hopefully this will be a better year going forward. It's been about a month since I last came to you with updates on COVID. We'll go quickly through sort of where we are, and then I wanted to focus a good deal on vaccines because we are getting lots and lots of calls and emails and discussions with our patients daily because everyone is, well, most people are excited to get it, and we're very pleased about that, but we know that it's been frustrating in terms of knowing who gets what when, and so I wanted to clarify sort of what we're planning, what we're doing here, and where we're at. So quickly, it was a very, very busy beginning of winter and late fall here at Lakes Regional. We had an average over the last month or so of 10-ish, sometimes 15, sometimes 5, but more around the 10 to 15 COVID positive inpatients here at the hospital, and that's out of a total of roughly 25 beds. So a lot of folks with COVID, a lot of severely ill folks. Unfortunately, there were a few outbreaks at local care facilities, which did lead to a lot of hospitalizations, and unfortunately our death numbers also rose significantly here in the county. As of right now, we're at about 23 known COVID deaths. The state website still says 21, but somewhere between 23 and 26 from our numbers. And it's taken a toll. Additionally, staff has been getting tired. We've been working hard. We're also getting much better at taking care of folks who have it. It's become, unfortunately, more routine for us to be managing people with aggressive oxygen management and remdesivir. And so some new developments since I last saw you. We are doing monoclonal antibody treatments for folks who are earlier on in their course if they meet significant risk criteria, so being over 65, or having some comorbid medical issues. So if you were to test positive, that is something that we can do to help prevent it from getting worse. That said, you need to talk to your doctor. You need to call our COVID hotline at 336-6696 to get seen, to see if you're a candidate for those things. Very limited supply, but that is a thing that does keep people from having to need hospitalization. So again, that's one of the things that has been proven to actually help prevent severe illness. Additionally, we've gotten better at taking care of folks who have it in the hospital, and right now we are down in terms of numbers of people who are hospitalized. I think we're at about 3 in our hospital right now who are COVID positive. And that follows a few weeks where the numbers overall of positive tests locally and across the region have dropped. That said, those numbers are starting to go back up. So our positivity rate was down to about 12% over a 2-week span around Christmas. Now we're back up to 17% over the last 1 and 2 weeks, and it's rising again. And I think after people were quite vigilant, or more vigilant around Thanksgiving than they would have been, I think some people might have gotten together for Christmas, etc. And so we're worried that that will continue to rise as people got together and potentially gave each other COVID. But time will tell. We feel prepared for it. Other exciting happening is that we started distributing the Moderna coronavirus vaccine. That is what we've been allocated thus far. Doesn't mean that we will have that going forward. Could be Pfizer. If AstraZeneca or one of the others gets approved, then we could end up having those later on in the course of this, because this is probably going to be a marathon in terms of getting everyone who wants it vaccinated. But we have now given over 500 doses here in the county of the Moderna vaccine. I had mine on the 22nd of last month, which is when we started doing it, and had a sore arm for about a day and had a little bit of a headache 2 days later, but that also could have been because I get migraines and that was what was going on. Otherwise, other people have had a couple reactions. You expect it when you start giving 100 vaccines. No, you cannot get a coronavirus from it. You do not generally get severely ill, and it is a safe vaccine. It's also very effective. So in tests, the Moderna vaccine was 94% effective in preventing severe illness. the Pfizer one was 95%. These are amazing vaccines, and they are going to be how we get past this. So I encourage everyone, when it is available to you, to get it. I think that's fairly universal around here that the physicians are strongly encouraging it. That said, we know that there have been some concerns because it is new. I think that the data is playing out that this is a very safe vaccine, and for the most part, it should be effective and will be safe for you. So talk to your doctor if you've got questions, but again, we encourage it. So there's been a lot of calls, as I mentioned, about when can I get it, where can I get it, who should I call, can I get on a list, etc., which is understandable. So it's been left up to the states in terms of how it's distributed, although the distribution is coming from the federal government. And unfortunately, Iowa and many other states have gotten less of an allocation than they thought they were going to get. So I believe we've had like 23,000 doses or so in Iowa, give or take, that have been allocated. Not all of those have been given, but Iowa Department of Public Health is managing who is allowed to get those right now. Right now, we are still very much in phase 1A, which is healthcare workers, which is defined as people who work in hospitals or inpatient care settings, or dentists, mental health providers, etc., and residents and staff of long-term care facilities, so assisted livings, nursing homes, and some conjugate living environments such as community-supported living for mental health concerns. So that's it. That's all we are allowed by public health law currently to distribute. So even if we had more doses, and we do have about probably 30 more doses that have been allocated to us that we have in our hand, we are not allowed to give them to anyone other than those healthcare workers and long-term care facility members or staff. So our hands are tied right now. That's stage 1A. We do not know yet when we are going to go into stage 1B. Based on CDC criteria and recommendations from the federal government, stage 1B would be all those over 75 and essential workers who are, let's see, I've got it written here, firefighters, police officers, correction officers, food and agriculture workers, postal service workers, manufacturing, grocery stores, public transport, and educational workers, so teachers, support staff, etc. It's a pretty broad list, but again, it does not take into account pre-existing conditions. It's not just 65 and older, it's 75 and older. So that will likely be where we go next. And that said, Iowa Department of Public Health, which has the reins on what we're allowed to do, has not said if they're going to specifically follow that, or if because of decreased allocation, it's going to be some subset of that. So we will be as open and transparent to you as we possibly can about who qualifies when, and we will be very, very vocal about how we're going to do it. Okay, so trust that if you follow this Facebook page, if you follow our website, if you look at the Lakes Regional Healthcare website, go to KUOO, etc. It's going to be everywhere when we have it available and when we're planning. So you will not miss out. We are setting up an online survey for those who know that they want it to go to the website, and it'll be through the Lakes Health website within the next week or so, so that you can enter your information. So it'll ask for your name, your address, your date of birth, so that we can stratify those age ranges, whether it's 65, 75, etc. And if you have any other pre-existing conditions, and how to be contacted. Once we have that data, that allows us to then more proactively contact people within those specific groups once we know what those groups are defined as. And so I encourage you, keep an ear out, keep watching the Facebook page, and once that survey is available, go to the website. That will allow you to officially sign up, although you are not signing up for a vaccine. That does not give you preference other than just knowing us knowing that you want it, okay? As we know how many people want it, and as we get a better sense of how many vaccine doses we have, we will be able to then even further tailor our planning for how and where you're going to get it. So that might be, most likely you will have to make an appointment, and it may be here at Lake's Family Practice, which is where we've been giving them 4 healthcare workers. It may be up at the Expo building as a walk-in, drive-through something or other. We'll see. All options are still on the table, and some of it depends on how much we're getting at once, and how many people want it. But we are expecting a fairly overwhelming desire based on the number of calls we're getting, which is great. We encourage that enthusiasm. We are thankful that everyone wants it, because that's really how we get through this pandemic, getting enough people to be immune. So after that 1B, which we're being told will likely be in a matter of weeks, whether that is 2 weeks, 4 weeks, 6 weeks, we don't know, but again, we'll let you know. Then it goes to 1C, which is people 65 to 74, or people with people younger than that with underlying medical conditions, or other essential workers who don't fit into the previous category. Then at some point, probably late spring, summer, that's when you get into the folks under 65 who do not fit into any of those other risk groups, or based on their demographics or their medical issues. So it's going to be a while till everybody's vaccinated. So we continue to urge you, please wear masks, especially when you're inside and especially when you're around people. Avoid large gatherings, cover your cough, wash your hands, all the stuff we've been saying for the last 10 months. It still applies. Still be vigilant. We're all sick of this and wanting it to be over. Thankfully, hope is on the horizon. So hopefully that's helpful. So again, we're only in 1A right now. There's no need to call right now because we will have an option for signing up when it's available. You will hear all about it. When we actually have the vaccine available, we will send out emails to those people who have already contacted us, and again, that will also be in the media so that you can know that you can go to the website and sign up, whatever that sign up system ends up being, or what hours to show up when and who's available at that point. So more information is coming, but we want to be as open about what our planning and what our limitations are right now in terms of who can get it and when. But we want to get as many shots in arms as possible, as quickly as possible. So we're with you. We want you to be safe. We want everyone to get through this. So call if you got questions, talk to your doctor, but keep watching this space and we'll give you more information as it comes. So again, Happy New Year. We're getting, I think this is the beginning of the end of this, and if it's another 6 months or 9 months or however long till we're finally through it, won't be soon enough, but keep being vigilant, keep taking care of each other, and have a great day. Thanks.